Well, it's just about 6:30, everybody, and I wanted to welcome you to our March webinar for the Periodic Paralysis Association. Tonight, we're going to be talking about acupuncture with Tammy Bennett, who is an acupuncturist that works with periodic paralysis patients here in the Orlando area. And she also happens to be my husband's acupuncturist. So we're all pretty good friends in Tammy's office. And quite soon, I think that Dan, Monica's husband, is going to turn on his camera so that you can see into Tammy's office. Monica Kramer, who is the treasurer of the PPA, is going to be our patient tonight, and she does see Tammy on a regular basis. Tammy Bennett melds a successful traditional approach to diagnosis and treatment with cutting-edge research and development in alternative medicine. Her work is based on over 20 years of practice, treating thousands of patients, and a desire to improve the quality and impact of healthcare to her patients. Tammy works remotely with patients nationwide and sees a limited number of patients in person in her Florida practice. Her work is based on over 20 years of practice treating thousands of patients and a desire to improve the quality and impact of healthcare to her patients. She uses a variety of natural, holistic therapies. And those include, of course, acupuncture, but also nutrition, other methods of Chinese medicine, approved marijuana treatments, and functional medicine, cytokine therapy, and herbal supplements. So, Dan, I am going to make you the presenter so that you can let Tammy maybe introduce herself and let Monica talk. So I'm getting ready to turn it over to you.
Okay, tell me if you can see our camera.
I can see you now. Hi, everybody.
Hi, everybody.
Just a second, and you will be on there. Yeah. So here you go, Dan. Okay, you've got it, Dan.
Okay.
Thank you, guys. So it's a pleasure for me to be presenting to your group today. I've done some work with the periodic paralysis group in the past, prior to COVID, where I attended an event that you all had, and it was fantastic. I learned a lot about the condition itself. And what's interesting is in traditional Chinese medicine, we perform a very rudimentary diagnostic exam based on thousands of years of data collected through traditional Chinese medicine practitioners. And a lot of it has to do with evaluating the patient when they're walking in the door, the colors that they wear, the color of the skin, the way that the eyes look, the fingernails, the tonality of the skin, the value of the pulse. And I'll do a pulse check with Monica today, my patient for today, looking at the ears and any creases, crevices, or red marks or blemishes on the ears. All of those are indicative of imbalances that occur per the individual. So it may not necessarily be a periodic paralysis common trait, like a genetic trait. It's a very individual thing. So when I look at a patient, I look at them as an individual, not just a periodic paralysis patient, although it's helpful to know if someone does have a periodic paralysis condition. So Monica, do you want to tell the folks about what we've done with you so far?
Well, when I first came to see Tammy I think it was like 2 years ago, I met her through our PPA support group here locally. And one of the first things, the day that I showed up, it was a pretty bad day for me with my periodic paralysis condition. I was clammy. You recognize that I had a weak pulse. And after just one visit with Tammy, I was feeling much better. And so then I decided, as I've heard from one of the other people with periodic paralysis said that acupuncture helped them, they were going every 10 days. I decided to try it for every 10 days, and it did definitely, it has helped tremendously. And it also has helped with other issues that I have, like pain, back pain, problems sleeping, whatever it may be. We kind of throw that in sometimes. So it's been very beneficial.
So one of the things that we'll do tonight is I'll show you how a traditional Chinese medicine exam looks. Since I know Monica, we're not going to do a long exam because I like to do the show and tell part, which is looking at the needles, understanding what they are, how they're inserted into the body, and what we're looking for. So in this case, like when I would observe a patient walking in the door, I look at the coloration of the skin. Monica has kind of more of a yellow tone with a little bit of red in her cheeks. Yellow indicates spleen and red indicates heart. So I would already know that Monica has maybe an imbalance of the spleen and heart. And then I look into her eyes, and her sclera is pretty clear. It's not yellow. She's not like jaundiced or anything like that. More of like a blue sclera. I don't see many dots around the eyes, so she's pretty clear there. That's usually the liver channel, so I know that the liver's pretty clear. And I would look at her ears. And Dan, if you want to zoom in, when I look at someone's ears, I look for, see this little red line right here? I know it's really hard to see maybe on the camera, but it's a little red line here. That's her low back. I would know that there's something going on in the low back by noticing that area. And I also would look at the lobe of the ear. I don't see many creases, so that doesn't indicate much going on with like cardiac issues. When I said earlier, red means heart, it just means that the heart meridian has some involvement here. And then the ear itself is also a microcosm for the entire body. And so this area here is the head and neck and throat area. This is the neck, this is the thoracic spine, and then this is the lumbar and sacrum area. And then in here is the internal organs, like this part here is the liver, this part here is the lung, and the kidneys are up in here. So I look for any strange discolorations or signs. So the only thing I really see in her ear today is that low back vein there, which means there's inflammation in her low back. I already know this because we talked a few minutes ago, and she does have something going on with her low back. She rides horses, and we think maybe the compression of that may be irritating some back pain stuff. So that's something we look at. And I also do look at the fingernails, but Monica has great nails, and I can't see what the fingernails look like underneath, so I won't even, imagine, but they are beautiful. So I just wanted to mention that. We're gonna go ahead and I'm gonna lay her down so she can relax, and we'll do the pulse checking. In traditional Chinese medicine, when we check someone's pulse, we are looking for pulse quality overall. So, when you check your pulse, what most people are looking for is the rate, like your respiratory rate, how many beats per minute. What I'm actually looking for is the quality of her pulse overall. Is it weak? Is it strong? Is it floating? Is it superficial? Is it deep? Can I feel it at all? Is it slippery? Does it roll around? All those things are indicative of things going on inside Monica right now that I can determine is an issue for her, and I can balance it out. So if you think about it, acupuncture is roughly 5,000–6,000 years old. So 5,000–6,000 years ago, they didn't have an MRI, CAT scan. They didn't have all the blood work devices and things. They had the pulse, the tongue, and the evaluation of the patient physically. So I'm doing those old school principle examinations to see what's happening in Monica's body. So I'm going to check her pulse. And the left side is weaker than a normal pulse, and it's superficial. So this means that she could be having some immune system issues going on, like fighting off a little bit of something. Her pulse rate is really nice. She's very calm and relaxed. It's not like thumping or aggressive in the pulse. And I check both sides because pulses, when you're checking this way, can be different from one side to the next. Although with Monica, it's very even. It's a nice pulse. I think I remember telling you, you have the nicest pulse for somebody who doesn't feel well. And it's a really good pulse, but it's just overall slightly weak. But each position feels even, right? So it's not like there's a weakness in one versus the other. It's overall just a slightly weak pulse. In addition to that, I do always look at the feet, and I check the temperature of the feet just to see if the limbs are chilly or not. That tells me some things about a patient. She's just a little chilly. not clammy like she used to be. I think that was a really, one of the big things we saw disappear early on was that clammy and some of the anxiousness around doing treatment and just even coming in not feeling well at all. So because Monica, we know, has hip issues, and is it your left hip or your right?
It's my left.
Your left hip. So left hip is treated by doing the right foot. So when we're treating something below the waist, usually we treat the opposite side. So in this case, her hip is bothering her. So we're going to do a classical acupuncture point here on the foot and the ankle to help treat the hip pain first. And then I'm going to add some acupuncture points for the overall weakness and imbalance that she has. Because she has periodic paralysis, a lot of what we do is we try to treat the midline, which deals with the parasympathetic and sympathetic nervous systems. We want to really balance that out. So I'm going to use a sympathetic point here. I'm going to use a meeting point here, which is where 3 meridians meet at the top of the head. And we're going to use some relaxation points in her ears. And I'm going to do something called Moxa Sebustion Therapy, which is a form of herbal heat on the acupuncture points to warm them up. I find that a lot of periodic paralysis patients have an issue with wind or cold blowing on them. And because periodic paralysis is such a unique condition, acupuncture doesn't have it defined in terms of channel disturbances, like is it a lung channel problem, a liver channel problem, a kidney channel problem. It's a multi-channel problem, not channelopathy, different, okay? We know channelopathy means something to you guys. It's different than what a channel is in Chinese medicine. We have 12 channels in Chinese medicine all related to the internal organ systems. And in Monica's case, there's multiple channels involved, so we want to warm them up. And anytime there's wind outside or someone has a wind condition internally, they feel lightheaded or their muscles twitch or contract, or they feel faintish, or they get into a paralysis situation. So we try to avoid any of that by doing preemptive treatments. So somebody doesn't have to come while they're under a periodic paralysis attack. They can come on a regular basis to prevent. So that's what we do mostly with Monica. The fact that she came in one time where she had an attack was very coincidental for that situation. So I'm going to have Dan come over to the table here, and we're going to look at some of the tools of the trade. So I use Japanese acupuncture needles. I find them to be very consistent, and they're very easy to use. They're all single one-time disposable needles. They come prepackaged in what's called ethylene oxide, which is a sterilization agent that's very safe. And each needle is, like I said, individually disposable. So I'm going to use the needles on Monica, but I'm going to do a show and tell real quick for you. The needle has several components when you open it. One is the tab, which is blue, and when I twist the tab, the needle is now able to be mobile inside the tube. And I use the guide tube to give me accuracy to the area that I want, but I don't know if you can see this. You might be able to see it against something dark. The needle is very tiny. It's an inch long, and it's the thickness of 2 or 3 human hairs. So when people ask me if it's painful, it's really not, because they're so small, but you do feel something, but I wouldn't necessarily call it pain. So we're going to let Monica be the decider here. We always throw our sharps away in a sharps container, just like at the regular doctor's office, so that's very common. We do wipe the areas with alcohol, so I'm going to go ahead and do that first. I'm doing a second pulse check just to see. I am going to add some lung points today, just because there's this very slight something with her immune system is just a little bit off. So I'm just going to do it to be on the safe side. Add that. And if you want to come around, I'm going to do the ones on the scalp first. So I open the needle, I discard the tab, I measure where the acupuncture point is located. There are over 1,500 acupuncture points on the human body. Knowing where they're located is part of the training that we receive. We usually find acupuncture points located in areas not so much on the torso, but in the extremities. And each of them has a number and a location that's specific to the patient. So, for example, if I have a gentleman who's 300 pounds versus Monica who's tiny, and her arm is this long, and a gentleman that big, his arm might be this long, we anatomically look for the acupuncture point based on the person, not just the location. So it's very patient specific. So that one was a little sensitive, right? That's the point where the wind type point is.
I find that whatever is giving me issues, those are the ones that usually.
So this one goes to the hip, so you may feel it a little more than others. You can see I'm using my fingers to measure where the acupuncture points are. Anatomical measurement is to the patient, and we use the finger length. I already know Monica's hands are pretty much the same size as mine, so I can measure. If I were using this technique to measure for a man who was a lot bigger, 4 fingers might be equivalent to a 3 finger on a female. So we use that anatomical measurement. This one is located on a bony prominence on the wrist, so I know where this one is located, and it usually zings a little bit. And now we're going to go ahead and use some what we call ear needles. Ear needles are very, very small. It might be hard to see on camera, but this is a 10 needle ear needle pack. We're going to use 5 needles on each ear. And they're super tiny. And this protocol is for stress, anxiety, rebalancing. They pinch a little bit, then they kind of disappear. Body points are more, what's a good word?
Sensitive?
No, they're not more sensitive. They're more, they're heavier. They're denser. Like, there's all cartilage right here, but when you're dealing with like bone and soft tissue, it's like there's a density to it. And I can feel it too. I can feel the energy of a point when I put it in. Like, I could tell Monica was going to jump with that one, and I thought she might jump with this one a little bit just because those are areas that need some attention. As you can see, I think you guys might be able to see, these are so small. This is probably the thickness of a hair and a half, maybe. It's super tiny. It packs a good punch for what it does. Acupuncture releases neurochemicals called corticosteroids and endorphins in the body. It also shuts off and on pain receptor signals. So for pain relief, for people that have chronic pain, back pain, neck pain, joint pains, rheumatoid arthritis, things like that, you can turn those gate centers off for periods of time to give people pain relief. That's why acupuncture got very popular in the 1970s. It's a good story to tell. It was about 1973 when acupuncture came to the United States, and the reason was because President Nixon had traveled with a group of people, including some people from the media, to China for peace talks. And one of the people involved in the media group had an appendicitis attack, and they had to take him to the hospital immediately. And they used acupuncture to alleviate his pain prior to going into surgery and post-surgically. And he was so excited about it, he nixed the story, no pun intended, on Nixon and wrote about acupuncture. And that's when acupuncture started to become a thing for people in the United States to start to really attach to and decide, let's pursue this. And when they studied it more, acupuncture became a common practice and became a licensed profession in the United States. And I think every state in the United States has licensed acupuncture physicians in it now. When I first started 20 plus years ago, not every state had laws and rules around acupuncture, and that's come quite a long way since then. I'm going to add for Monica now an electrode onto the acupuncture points on her feet to help with her hip pain. So I'm using a microcurrent device, and the microcurrent device is going to attach a positive and a negative to each of the needles. So here's the neg, and here's the pause. And I'm going to turn on the machine, and it's going to pulse at a very slow rate. And Monica, you just tell me when you feel a tap, tap, tapping sensation on your foot.
Okay.
Okay. So it's just dip, 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 like that. So this is sending a signal to her, to her brain. Is it bothering you?
No.
No, okay.
It's like somebody's massaging my hip.
Yeah. Oh, yeah. So it's sending a signal from her brain to her hip. And what's going on in her hip is a flood of anti-inflammatory chemicals that helps reduce that discomfort in her back. So in the meantime, to balance her out, I'm going to do something called Moxa, M-O-X-A. So I'm going to light something called a Moxa stick, which looks like a little tiny cigar. It burns very similarly to like a charcoal briquette. So I'm going to light the top. It'll turn kind of a reddish. And I'm going to heat up the needles on Monica's head and the ones on her wrists to help boost her immune system and quell that wind type feeling. It's been windy outside lately, and the temperatures have dropped and changed. So it's very common for people to experience wind conditions during this time. Dizziness, foggy brain, weakened immune system, and so on. And sometimes hemiparalysis can occur during wind episodes. We classify wind episodes with hemiparalysis of the face, like Bell's palsy, seizure disorders, periodic paralysis disorders, and strokes. We also can apply Chinese herbs in conjunction with using the acupuncture and the Moxa therapy. It depends on each patient and what's going on with them, whether we prescribe an herbal formula or not. We do a lot of that with internal medicine issues. For example, I have somebody that comes in with colitis and they're having a flare-up. I can prescribe Chinese herbs and acupuncture together for the patient, and I monitor them closely while they're doing the herbal therapy. We monitor usually by text and make sure that everybody's doing well. And then we can change the herbs or reduce the herbs or get rid of the herbs completely if the condition resolves, and like the colitis or IBD or IBS or whatever the situation is goes away. And I've used herbs for many conditions, including wind conditions. I have clients that come in to see me after they've had a Bell's palsy attack, which is a paralysis on one side of the face. It's usually a viral condition, but in some cases there is no virus and they're not sure where it comes from. And we use Chinese herbs for that, along with the acupuncture and the Moxa therapy. So I'm going to, well, you can't see heat, but you might be able to see a little bit of smoke coming off of it. It's hard to tell, but it is warm at the tip. And what I'm going to do is slowly apply the heat to the top of the head here where the needle is. And it's basically like an amplifier to the needle. It helps it work faster and provides more of like a soothing effect to the needle. The warmth is helping improve blood flow and circulation, but also the energy in each of the meridians where this meets. So this is a meeting point of multiple meridians. Monica, are you feeling the heat yet? Okay, let me know when you get it. The scalp is not as sensitive as the rest of the body, so it's hard for the scalp to heat up. Takes a few minutes. Or my patient just has a hard head.
It's weird because sometimes it doesn't. I don't feel it. And then
Yes.
bam, I feel it.
Sometimes it takes a few applications. So this is 1.5 applications, and it might take a few minutes. Other clients feel it right away. Usually once I get it, when I reapply,
I feel it.
there it is. Okay. Then I come back to it and she'll go, oh yeah, I feel it faster. That's pretty common. We're also going to do this on the wrist points. This is a lung point that I'm doing the heat on, just because of that little bit of an imbalance in her pulse.
I feel it now.
Good. And we're going to move to the other side. It has a nice smell to it. It's kind of, if you've ever used sage or burned sage incense, it smells much like that. Little kind of a smoky, you feel it. Yeah, that one's faster.
Yeah.
Let's go back to you. So we're going to go back to the top of the head and see if she feels it any faster.
Good.
I normally do 3 passes, so this is the second one here. This is our assistant. He's not really good with acupuncture points, but he's great at relaxing us. I don't know if you can see this or not in the audience, but it's following her pulse. It's going,
The needle?
moving. Yep,
Oh, wow.
it is. It's very close to that pulse there. The actual Moxa itself, you have to break the ash off pretty frequently in order for it to do what it needs to do.
Yeah, I feel it.
There it goes. Okay. Okay, so we're going to do the last pass on each of the acupuncture points. I don't know if you guys have to raise your hand and ask questions, but now would be a good time to do that. We're going to retain Monica's needles for 15 more minutes after this, and then we can do questions if that's okay with you guys.
So I am back here, Tammy. This is Linda, and we did have some questions submitted prior to the conference. So maybe you could answer some of these while we're waiting for some to come in online.
Sure.
I have one that says, I am a 28-year-old reasonably fit guy who lives in Malta. So he's a long way away.
Yes.
My symptoms are very strongly correlated to my diet and exercise routine. He does have periodic paralysis. Typically, my symptoms are muscle weakness, which results in muscle pain after I take potassium supplements to stave off full body paralysis. I've had some success with acupuncture in treating the muscle pain, but not the underlying condition, which I understand is only treatable, not curable. Do you believe that acupuncture could be used to treat the muscle pain as a long-term solution? More specifically, if done in a certain way, could I be pain-free after several sessions and no longer need acupuncture, or is acupuncture solely used as pain relief? And if the acupuncture is only usable as pain relief, what are the benefits of continuing the more expensive treatment through acupuncture as opposed to the much cheaper alternative, over-the-counter painkillers?
So that's a really good question. So you've got a multi-layered question. Let me go from the backwards forwards.
Okay,
As far as the over-the-counter medication, yes, less expensive solution, but possible long-term side effects that you have to weigh out what works best for you. So, for example, I've had clients who have long-term use of NSAIDs, and they've had stomach problems and other gastro bleeding issues where that's been a long-term issue for them. So they like to use acupuncture and more holistic methods to stave off that particular type of problem. So that's one way to answer that question. If cost is an issue, there are places that do, and I don't know about Malta, they have community acupuncture programs where they have people in a community setting where they have maybe 10 lounge chairs in one room, and the acupuncturist can do treatment. It runs by the 15-minute increment, and they can treat 10 people at a time. And that way it's more affordable. I think they charge like half the price in something like that. It's not in a private room. They don't do the Moxa. They don't do the cupping and things like that. But it's a way to make acupuncture much more affordable for someone who's want to keep it going but doesn't have the means to do so in a private setting. So that's an option. As far as curing or I'm going to use the word remission instead of cure, right? Because that's the appropriate thing to use. So with periodic paralysis, my understanding is this is a genetic condition that's not curable at this time, although there's lots of incredibly good stuff coming down the pike that I've heard about through you guys. Acupuncture, I would say it's very individualized. Some people are going to get greater remission periods than others. So for example, Monica, how long did we go where you had no PP?
Months.
Yeah, so Monica had months of what I would call a remission period, much like when I have lupus patients or scleroderma patients or multiple sclerosis patients, they go into long periods of remission. So I think acupuncture has that ability, and I think each person is different. So it depends, and every practitioner is different. I mean, I have a different skill set than other people do. We all go through the same school, but it's what happens after school, like the track you take for your continuing education credits, the track you take for what you're most interested in. I mean, I have colleagues who specialize just in fertility, and they help people get pregnant, and they do great, and they have high success rates, and they don't do anything else. I have other colleagues who do just pain management, and they just treat people with pain. And I have other colleagues that just treat internal medicine, and other people that just do skincare and anti-aging. So it depends on the practitioner as well. So my answer is a little bit evasive, but I think it makes sense because everybody's so unique and different, and every practitioner is different. So cure, no. Remission, yes. And yes, I do think that it's available to you, and I do think that practitioners out there have a good handle on how to do long-term remissions of muscular pain associated with periodic paralysis.
Okay.
I hope that was it.
I've got another question for you. I saw that you had a particular interest in Eastern medicine, and I've never heard of this, Tammy, but this person is wondering if something called Ayurveda, A-Y-U-R-V-E-D-A, for example, could have a positive influence for people with hypokalemic periodic paralysis. If that would be the case, why is that, and how could someone start themselves? He was just thinking that it might be hard to start at the beginning, and then the positive effect might be seen later.
So acupuncture and traditional Chinese medicine is separate from Ayurvedic medicine. And Ayurvedic medicine is something that I don't have a strong background in, other than to say, if memory serves correctly, there is a physician, it's not Sanjay Gupta, it's, he wrote the book, Body, Mind, and Spirit. Oh, I see his name. Anyway, there's a very prominent physician that is on television. It's not Sanjay Gupta. It's another physician that has Ayurvedic medicine background. And I think following that Google search might help us understand if periodic paralysis would respond to Ayurvedic medicine. But Ayurvedic does not incorporate acupuncture at all. Ayurvedic is more lifestyle, dietary, and oils and herbs associated with Ayurvedic principles. And Ayurvedic principles deal with 3 main body types. I think it's the Vata, the Pitta, and there's one other one. And they body type and diagnose and give you lifestyle modifications to that particular body type. And I don't know if the genetic variants in periodic paralysis are part of what they can do with Ayurvedic medicine. Not a great answer, but, and if I think of that,
No, I had no idea what it was, so thank you. Somebody else here that's online tonight says, I have been using acupuncture and hypnotherapy as a way of symptom management. My acupuncturist focuses mainly on balancing my hormones, as there is a direct connection to my attacks and my monthly cycle. Do you also recommend herbs, or are there certain herbs that we should be cautious with our condition?
Yeah, so herbs are interesting because herbs can be incredible and they can be incredibly complicated. So I would say that the first thing, you know, Monica and I have talked about this before, whether the menstrual cycle is a precursor to a possible attack. And, you know, the hormones are still very complicated and we still don't know everything about them. So I would be very cautious about herbal medicines that affect the hormones. And those are adaptogenic herbs and androgenic herbs and estrogenic herbs, things like wild yam, and anything that would affect like testosterone, like deer antler, and those things I would be cautious of. The herbs that I like for conditions like this are the ones that are related to reducing wind in the body. I go back to that again because the most periodic paralysis patients fall into that wind category. And so the wind reducing herbs are the ones that I like the best. Gastrodia is one of them. And there's a whole pharmacopoeia. It's about yay thick on
Oh my word.
We could go down a rabbit hole for a really long time on that. But my caution is if your traditional Chinese medicine practitioner is good with herbs, go for it. If you feel confident and they know how to diagnose. If you're just doing research and looking online, I would not just take any old herbs and see what happens, because it can be detrimental to your physical health taking the wrong herb.
Okay. Now we have somebody that says, I have periodic paralysis and ME/CFS. And I'm not sure. ME/CFS. You know what it means?
Chronic fatigue syndrome.
Oh, okay. Chronic fatigue syndrome. Okay. All
Yeah.
right.
So,
will acupuncture help her?
For sure. Chronic fatigue syndrome, I'm not sure the ME part, it's coming to me. I'm sure it's there in my brain somewhere. But chronic fatigue syndrome is something that acupuncture works really well on, because acupuncture can help support a healthy functioning immune system. And chronic fatigue syndrome patients have depressed immune systems because of their exposure. And CFS comes from different reasons. So a lot of the symptoms associated with CFS, including the huge lack of energy and problem sleeping and hormonal dysfunction, can be regulated with acupuncture. So I would say a big yes on that one.
Okay. And someone said that the name you were probably trying to think of was Deepak Chopra.
I knew as soon as somebody said yes, exactly. Deepak Chopra. Healthy body, healthy mind, I think is but yes, he's a big Ayurvedic guy, and I would follow him on Google and see what Ayurveda has to say about periodic paralysis or conditions related to channelopathies specifically. Yeah.
Yeah, and that ME that someone was talking about is myalgic encephalomyelitis.
Wow.
Myalgic.
Yeah, that's an inflammatory condition. Acupuncture is good at helping reduce inflammation. It can't hurt the person, but it's not going to be the cure-all on ME, right?
Okay.
That's something that needs attention further than, where acupuncture.
Yeah.
That's a good one for herbs. Really good Chinese herbalist can help with that.
Really? Okay.
Yeah.
I've got another question from somebody that wrote into me, and that is that this person had a really good experience with acupuncture, and he has been seeing a doctor on the outskirts of Shanghai. Well, he did for 4 years, and he had he had treatments of about 3 months per year with this doctor in Shanghai, and then partly he went back to Europe. I think this man was from Austria. After examining me for about 1 minute, with an exclamation point he puts after that, he said that he had never seen such a disease, periodic paralysis, but he can take half of the problem away. That really came true. Before I could press a hand device with 220 pounds on a very good day. Then it came down to 90 pounds when my periodic paralysis had aggravated. And after the treatment, it has now stabilized at around 150 pounds. The treatment was tough, however, 3 times a week for about 4 hours each, with 300 needles per treatment. The needles went in up to 2 inches, but it worked, and I had no complete paralyzation ever since. That.
So let's talk about this. Traditional Chinese medicine is taught in the United States in compartments, right? So there's the Chinese methodology, the Japanese methodology, the Thai methodology, the Korean methodology. Every Asian country seems to have a little bit of a spin to what they do with acupuncture and Asian medicine in general.
Yeah.
So the Chinese are very commonly heavy-handed, lots of needles. A lot of times in China, because of their medical system, acupuncture is paid for by the nation, right? Or by their country. And so you can go to acupuncture 4 or 5 times a day for months at a time to get a condition treated, which is a very Chinese way of treating a condition.
Mm-hmm.
So it doesn't surprise me that he had a 4-hour treatment. It doesn't surprise me there were lots of needles. It doesn't surprise me that it was heavy-handed. In the United States, we typically can't get off work and see an acupuncturist 4 or 5 times a day, 3 times a week, 4 hours at a rip. It's very rare. So I think there's been a modification of styles to help. Conversely, in Japan, they use a very fewer needles, better outcome is the concept. It's a 4 or 6 needle protocol. I studied Toyohari Japanese acupuncture somewhere up here. It's up there. I studied for 1.5 years Toyohari Japanese acupuncture, and I like that for something like what I have in a condition like what Monica's got. If I did 300 needles on her in a 4-hour treatment, she would never make it through. She would might throw up, or I mean, really, it's too heavy a treatment for her. So each style lends itself to the patient that's presenting with whatever condition they have. It doesn't surprise me that that was a man who got that treatment. I've seen football players, like big, I can't remember his name, Pittsburgh Steelers guy. I think he's retired now. I watched him have acupuncture with his therapist, and he must have had 150 needles going all the way up and down his back and stuff. And it worked for him. But you have to look at the patient and determine what style fits best for them. So with Monica, I use a Japanese Chinese methodology combined, and the Moxa is very Japanese. So I use a lot of Moxa with her because of the condition that she's presents with most of the time. But like I said, if I did 300 needles on Monica, there'd be no way. I mean, she would be sick. And it can be painful. There's
sure.
especially when you're going 2 inches in and you're aggressively getting chi with someone. But if someone's in the midst of an attack and the Chinese medical doctor is working to kind of work through that channelopathy, it wouldn't surprise me that they might use an aggressive style for that. I think here in the US, we see more chronic. Most people that have an attack, they might end up in the hospital versus, you don't usually call your acupuncturist, I'm having a periodic paralysis, I'm going to go to my acupuncturist. It's kind of rare here in the US that would happen, right?
Yeah. What do you think about him saying that he's never had a complete paralysis episode ever since he did this? I mean, this is a long time now that he hasn't had.
It doesn't surprise me. I think there's a key somewhere in here to unlock the channelopathy mystery. And maybe the guy in China could help us write like their findings and what their thoughts are, because we've looked in different pieces of literature, all of us together, and I can't find anything. My colleagues can't find anything. Monica had some guy in Israel that was practicing acupuncture. We looked at his, as a matter of fact, I have it right here, his book, and we can't find anything in here that talks about channelopathy specifically. So
Right.
I'm really looking for research and data points to collect and figure this out, because maybe he's got some information he can share with the rest of us so people don't have to go to Shanghai.
Yeah, that would help.
Not easy
That would help.
these days.
I think that anybody that's listening tonight, if you do have any experience with acupuncture, certainly reach out and share it with me, and I will make sure that Tammy gets it.
For
Because
sure.
we are looking at this as, more than just for pain therapy, but maybe there's something else that acupuncture can do for periodic paralysis, but we just can't find the information on it.
Yeah, I'm going to take a network of us maybe getting to the periodic paralysis group some of our notes and maybe combining all that together so that we can stay up to date with one another with what we're doing. And I had another patient that was seeing a physician up in Gainesville, I think it was, and they were doing something called back shoe points, which is a very Japanese style treatment where the patient lays face down and we do the needles all the way down the spine. There's two layers of acupuncture points that go down the spine. That's probably a 50 needle protocol. And she was getting good results, going again, like Monica, months without incident. It didn't erase the problem completely, but it really helped. So, there might be something there too. In my world, each patient is very different, and we treat the patient the day that they're here. We don't label the condition so much as we label the patient with what's going on with them. If I had another periodic paralysis patient come in, I may not do any of these acupuncture points with them at all, because they may need something different. But if there's some link to some acupuncture points that make sense, I would love to know what they are. And if other practitioners are doing stuff, let's try to get all that information together.
A friend of mine, Folkert, over in Wales, just wrote in a question, and I don't know where we're going to find somebody to do this, Folkert, but he said, have you tried reading research in Chinese? But
so that's
I don't have anybody that reads Chinese.
Yeah, I don't read Chinese. There are people here. I know that the University of Central Florida has a department where they do you have to pay for it, but they do translate. So that might be something. If this doctor in Shanghai has his notes, we might be able to translate his notes and find out what he did. And yeah, I know that there are definitely students that do translation for Chinese. I actually had somebody to do a PowerPoint presentation for me in Chinese. So, vice versa.
I wonder, Tammy, if you could talk a little bit about CBD and what effect do you think that has on people with periodic paralysis?
Yeah, that's a tough one because CBD is a modulator. So CBD has the ability, well, let me go back. CBD is part of the marijuana plant that is, it's one molecule of many molecules inside the plant that has a medicinal value. CBD does not contain THC unless it's combined with THC. And in the state of Florida, 0.3 THC combined with CBD is legal for sale without a medical marijuana card. Anything above that, you have to have a medical marijuana card to get it. I don't teach or advocate medical marijuana in my practice. I'm supportive of it, but I don't have the medical marijuana background. I have a CBD background. And CBD is a modulator of many systems in the body, right? So it's anti-inflammatory. It is supportive of balancing the hormones. It supports a healthy balance of the immune system. It also supports healthy balance between the parasympathetic and the sympathetic nervous system. So those things are all positive to periodic paralysis patients. I have not seen where CBD has been a curative or a remission on the road to remission for periodic paralysis. I don't know if there's been any studies to that either, because there may be a study out there that we don't know about where CBD has been beneficial. I do know that my periodic paralysis patients that have anxiety or sleep disorders benefit greatly from CBD, and those that we are suspicious that the menstrual cycle might be a hormonal trigger, that's also a benefit.
Okay. And where, say somebody was having trouble with their hormones during their menstrual cycle, where would you use? I mean, do you want them to take the CBD internally, or do you want them to rub it on?
No, I would have them do CBD internally. That's where you're going to get your best benefit. There are several ways to get it. So internally, drops or gummies or something, you eat it, ingest it is one way. The other way is to apply it topically through a patch. I've seen transdermal patches work really well. They're very fast. Usually put them on a venous area, like on your wrist where the veins are popping out, and you put it right on top, and it transmits through there. The creams and lotions have a tendency to be much sharper. It takes a little longer for them to take effect, and they're usually local. So if somebody has a sports injury, I like CBD for that, like bad shoulder, sprained an ankle, or something like that.
Right.
But for what's going on with periodic paralysis, as a channelopathy, you need it everywhere. So I would take it internally for that purpose.
Okay. Okay.
And for hormonal.
The mics are open for everybody who is online with us, and if you have a question and you hit that, I think you're seeing a little red mic beside your name. If you just hit it, you can actually talk to us if you want to. So I see a couple people that have asked questions, and I think I've read your questions, but if there's anybody else that would like to just talk, go ahead. I'll shut up.
I'm going to start taking Monica's needles out at the same time.
Okay. Is there anybody? We're all friends here. And if you have any questions about anything else that we can help you with tonight, please just let me know. You know, we don't often get a chance to just talk to one another, so we use these forums as kind of a support group for periodic paralysis. So if you have something that you would just like to throw out there to the group, you can do that. The mics are open. Sam, do you have something you wanted to say?
Hi, can you hear me?
I can hear you.
I was just wondering how Monica feels after the session, if she's noticed any differences in her muscles.
So I have paramyotonia congenita. That's the form of periodic paralysis I have. So I have, my muscles are usually like very tight, a lot of contractions. And after my acupuncture, as you can tell by it's hard for me to talk, my body is finally quiet. It calms the muscle spasms. I mean, sometimes I've come where my back is just excruciating because it will not stop. You know, those muscles will just not relax. And wherever she puts the needle, sometimes it's almost immediately release from that. So it is amazing. I did have one episode. I actually came here one day and started having an episode, and the acupuncture quieted the muscles while, you know, we only had a few needles in. And then there was one time when I was in a wheelchair, and you put in a few needles, Tammy, and the disorientation that I get from, from my bad episodes or the nausea went away. And I definitely feel positive results almost immediately.
So Tammy,
Tammy, you want to
goes-
tell them what you're doing now to Monica's ears?
Yep. So Monica has what's called ear seeding, seeding, seeding. And what I'm using is what's called vicarious seeds. They're stuck to little Band-Aid strips, and they act as acupressure points for Monica while she's not here. So she'll keep them in for about a week or two between treatments in order to continue to apply pressure to the areas of the ear that help with anxiety and relaxation and reducing muscle contraction. So that's what these are for. And I put 5 of them on each ear. It's a common protocol to use for any type of anxiety disorder, but we also use it for some musculoskeletal conditions. And we find it to be very helpful for people that suffer from depression as well. And we also use it for people suffering from addiction. There's some very specific protocols with these for people who have opiate, alcohol, addiction issues, and we help them with that as well.
Yeah, that's something that my husband has put in too by Tammy. Not all the time, but sometimes, just depending on what she sees in him that day. And he doesn't have periodic paralysis. He's being treated for back pain and knee pain. And it's been just amazing. It's kept him from, well, he's been able to keep moving around. I mean, he helps me, and he is able to live a pretty much normal life with the help of acupuncture with Tammy. So I've become a firm believer in it. I really think it does wonders. And I know one day I had a really upset stomach when he went in for his appointment with Tammy, and she showed me a place that was on my forearm, Tammy, that you said to just, if you ever feel like that, you can put pressure on it and you can relieve some of that.
Yeah, that's a pretty common point. That's actually a spot for nausea, for gas, for IBD. It's interesting because there's thousands of acupuncture points, and a lot of them do different things. So, like, for example, if I did a spot over here on Monica, this could work on her colon. This could help her hip. It could help the shoulder directly. So there's different ways. It's like, I use the analogy about driving somewhere. Like, if we want to drive from here to Miami, we can go a couple different ways, right? We could take 95 straight. We could go all the way down 75 Tamiami Trail and go up. And there's different ways to do what we need to do. And acupuncture has different ways to do a lot of different things. So not all acupuncture points are created equally. They do a lot of different things. So one thing might look weird, but it affects one other area.
So you,
Oh no.
Monica?
I'm sorry, Linda, what did you say?
I said, are you okay? Everybody wants to know if you're all right.
I'm totally okay. I'm very relaxed right now. My pain is much better. I just feel like I'm ready for bed now. I feel great. I do. I feel really, really good. And it's funny that Tammy picked up on my lungs, because today when I was exercising, my breathing was more labored than normal. And so when you were, and when you said something about my lungs, I was like, that probably explains why I was having such a hard time breathing earlier today. So
Yeah, I think the pollen's been super thick.
Yeah.
It's affecting a lot.
all right.
Well, does anyone else have any questions? This is our last call. I think we've tried to answer just about everything. And we will be back again next month with another webinar. You will be getting notice of the next webinar, and this was all recorded tonight, so it will be on our PPA website for you to look at anytime you want to. Tammy, is there any way that you can, do you have any big book of acupuncturists around the country?
You know what? I don't have a big book, but I do have a resource. It's called N as in Nancy. Well, hang on. It's nccaom.org. So it's National Certification Commission of Acupuncture Medicine, nccaom.org. And you can go into the section where it says Find a Practitioner, and you put in your zip code, and it'll give you a list of people that are in your area to call.
Yeah, could you just repeat that one more time?
Yep, it's nccaom.org. So National Certification Commission of Acupuncture Medicine.org.
All righty. Well, thank you, Tammy. It's been wonderful. Thank you all who have attended tonight. I hope that you learned a lot about acupuncture, and we're always here for you to answer questions and get you in touch with people that are practicing acupuncture around the country. I can always email you that site that Tammy just gave to you. And I want to thank Monica for being our guinea pig tonight, and Dan for being such a great photographer. So thank you all, and we will see you next month with another exciting webinar. I'm not even sure what it's going to be yet, but we're tossing some ideas around. And if you ever have something that you would like us to do a webinar on, please let us know. You can always email me at linda.feld, that's F as in Frank, ELD, at periodicparalysis.org. And I hope that you're all looking at our new website. It's fantastic, it's beautiful. And also watching our docuseries, which is coming out once a week. We're adding another portion of the docuseries. So the beginning of next week, you'll be seeing another episode of the docuseries, and this is going to be going on probably for the rest of the year. And you're going to get a lot of good information. So just stay in touch with us. We'll do anything that we can to help you. And thank you for joining us tonight. So good night, everybody. Be safe, and I'll talk to you soon. Okay, good night.